Let's talk about the common cold. First off, no, unfortunately today, I cannot tell you the cure for the common cold because indeed there isn't one. And the reason is that the cold virus is actually a bunch of different viruses. There are over 160 different types. All of those different serotypes of the cold virus mean that the virus itself has a different shape on its outside. And as a consequence, even if you've been exposed to a cold and you've developed antibodies against that cold virus, the next cold that comes along very likely has a different shape, and therefore your body's antibodies to the cold virus it combated successfully before can't latch onto and defeat that next different serotype of the cold virus. Fortunately, there are a lot of different things we can do to improve the function of our immune system and ready as possible to combat cold and flu viruses. So what are those? Things like getting enough quality sleep each night. How much is enough? However much you need in order to not feel sleepy during the day, except maybe the requirement for a short nap. In addition to that, we know that exercise, getting regular exercise of 60 minutes or less per day, making it of sufficient intensity for your innate immune system to deploy more of those chemicals and for your lymphatic and blood circulation to increase their exchange of materials enough that your innate immune system is bolstered. However, you can get this improvement in innate immune response with as little as 20 minutes per day, and probably even as little as 12 minutes of very high intensity training. And then of course, we hear about stress, that we're all supposed to regulate our levels of stress. Chronic stress, or even short periods of stress that impede our ability to sleep at night, can indeed reduce the functioning of our innate immune system. However, it's also clear that short bouts of stress, provided that they don't inhibit our ability to sleep that night, can actually enhance the function of the immune system. Right now, I just want to mention that the gut microbiome, which are the trillions of little microbacteria that interact heavily with the immune system and help support the immune system, you want to keep the gut microbiome healthy. And that the microbiome doesn't just exist in the gut. The microbiome also exists on the surface of the eyes and in the nasal passages. And indeed, the microbiome that's specific to the nasal passages is very different from the microbiome that exists within the mouth. And the microbiome that exists within the mucosa of the nasal passages seems to be the most effective at combating any viruses that we encounter, especially cold and flu viruses. This is where I get to make a strong push for being a nasal breather. And there are a couple things that one can do in order to make sure that the gut microbiome is best supported along that entire length. And that is to consume anywhere from 2 to 4 servings of low sugar fermented foods per day. So things like sauerkraut, things like kimchi, things like kefir, things like kombucha, or pickles, and of course things like yogurt, which have active live cultures. You can also consume a prebiotic or probiotic in the form of capsule form. Things like AG1 athletic greens also contain prebiotic, probiotic. Now there's another tool that you can use to enhance your gut microbiome. I have to warn you, this one might make a few of you cringe a little bit, but this is one that I actually started doing about 4 months ago. So what this protocol essentially consists of is pour yourself a little bit of water, clean, clear water. Then you take a sip of that water when you wake up in the morning prior to brushing your teeth, and you swish it around in your mouth, and then you swallow it. Well, it might seem gross to you, but throughout the night when you're sleeping, especially if you are a nasal breather while you sleep, the environment within your mouth is such that you're breeding a lot of bacteria. You are creating all those little microbacteria that potentially can inhabit your digestive tract and provide at least some of the substrate for the microbiota in your digestive tract to thrive. Okay, so now we get to the portion of the discussion that I think probably many people are anticipating, which is what can you take to reduce the probability of getting a cold or flu or shorten the duration of a cold or flu? First, let's consider what most people believe to be a very effective way to hasten colds or flus. The big one there is vitamin C. We hear all the time, vitamin C, antioxidant. Here's the deal. There is some evidence, and it's not great, frankly, that points to the fact that taking 6 to 8 grams, so that's 6,000 to 8,000 milligrams of vitamin C per day, that is a lot of vitamin C, each day can perhaps delay the onset of a cold or shorten the duration of a cold. So here we're talking about very high doses and not a very robust effect. That is not to say that vitamin C is of zero benefit for reducing the probability of colds and flus, but I must say, provided that you're getting sufficient amounts of vitamin C from your food intake. It does not seem that taking high doses of vitamin C is going to be effective for treating or preventing colds and flus. Now, what about vitamin D? We hear a lot these days about the importance of having sufficient vitamin D levels, and ideally everyone would get their vitamin D levels measured by regular blood tests. I think that for most people, supplementing with 1,000 to 2,000 international units of vitamin D is probably safe. Taking 10,000 or more international units of vitamin D could possibly be detrimental. I think it's fair to say, based on papers that I was able to glean, that vitamin D itself is unlikely to be the sole protectant against colds and flus, but it's probably a good thing to include in your general kit of nutrition and supplementation tools if your goal is to keep your innate immune system fighting off colds and flus sufficiently. By contrast, there are pretty darn good data that support supplementing with zinc as a way to combat colds and flus, in particular colds. Now here, the dosages really matter. It's been shown that if you take less than 75 milligrams of zinc in supplement form to try and impact the probability of getting or shortening a common cold, it's not going to work. You need to take 100 milligrams or more. And now 100 milligrams or more of zinc, for some people, is going to cause some gastric distress if you take it on an empty stomach. Taking 100 milligrams of zinc, perhaps divided up into 2 doses of 50 milligrams each, or maybe 100 milligrams all at once, but making sure that you take that with at least a moderately sized or full meal certainly could be advantageous. Also keep in mind that children, meaning people younger than 15, should probably not supplement with too much zinc. It can be problematic, and certainly pregnant women should talk to their doctor before supplementing with zinc. One of the more interesting aspects of supplementing with zinc that I was able to find in the literature is a 3 times faster recovery rate for people that already contracted a cold. So in this study, people weren't taking 100 milligrams, but the dosage came pretty close. They were taking 90 milligrams per day of zinc acetate, and they experienced a 3 times faster recovery rate from that cold compared to people who were not taking the zinc. Now, of course, there could be other factors as well, but the study was fairly convincing.